Please subscribe to Adil Muhammad Yusuf channel and click the bell icon button to get notification about all new videos.
In this short video tutorial, I am going to explain you the most common nursing interview questions and their best possible answers you can expect to be asked in your interview and advice on how you can craft. The first question is, why did you choose to be a nurse in the first place? The answer is, I wanted to choose something as a career option that would not only be challenging and interesting, but would also help me make a difference at a personal level. Being a nurse helped me deal with many new things and with many new people and helps me make a difference. The second question which can be asked is, how have you trained yourself to deal with the real challenges? The answer is, my clinical training at the emergency room of so and so hospital prepared me to deal with the real challenges that may arise. The third question is, what is the most difficult part of the job according to you? The answer is, the most difficult part of the job for me is maintaining a distance from the patient. I find it extremely difficult not to invest in the patient's sufferings all the while monitoring his or her condition minutely. It becomes all the more difficult when the patient has problems communicating the pain to the doctor. The fourth question is, what do you do to handle stress? The answer is, I handle stress by prioritizing on the most important thing at the moment. That way, I am not only able to make the best out of the situation, but also ensure that there is no further stress arising from the possible mistakes at the present. In the ER, it is the patient. In my home, it is exercise. The fifth question is, how would you deal with an unfriendly doctor? The answer is, I would try to talk to the doctor to know if it is anything that I should look into. But if the thing is more complicated, I would talk to the supervisor. The sixth question is, how would you deal with a patient or his family displeased with your services? The answer is, I understand that it may not always be possible for the patient or the family members to agree with my recommendations. In that case, I would like to use my communication skills to the best of my abilities. And if that doesn't work, I would speak to the supervisor or the attending medical officer depending on the case. The seventh question is, what does good care mean to you? The answer is, good care for me means where the conditions are optimum for me to give the best to the patient under my care. Ideally, I should not be troubled by uncooperative peers, unrealistic schedules, and overbearing relatives. Good care for me is ensuring that the patient gets the best out of her stay with me. The eighth question is, where do you see yourself in the next 5 years? The answer is, in 5 years' time, I see myself as someone with better understanding of the medical industry, and I want to have contributed more to healthcare services than is possible for a CNA. So I definitely see myself in a managerial role in this hospital where I would be able to benefit the patients more. The ninth question is, what do you think recommends you for this position? The answer is, I would make a good choice for this position because for me the patient's health is of the utmost priority. I am a good caregiver, I make people around me comfortable, I am an excellent listener and a communicator, and I am not afraid of speaking out when the need arises. The 10th question is, what was your previous boss like? The answer is, so and so was an efficient manager who knew how to get the best out of her team. I have learned a lot working under her. The 11th question is, why are you leaving your current position? The answer is, I feel that I have contributed enough to where I am engaged at present, and I want to broaden my horizon and take up new challenges and contribute better to the cause of healthcare. Question number 12. What are your strengths and weaknesses? My biggest strengths are that I can keep a cool head and think on my feet. I'm very good at listening to and following up on instructions, and I have good leadership qualities. My weakness is my tendency of getting attached to my patients. While a certain level of attachment is necessary in my area of occupation, at times it affects me emotionally, but with increasing experience, I am gaining better control over it. Let's move toward question number 13. What kind of salary do you expect? Answer is, I would be comfortable with a salary that is appropriate for the position and the amount of effort that I would be putting into it. I would also expect it to take into consideration my experience and the high cost of living in Dubai city. Question number 14. What have you learned from your past experiences? Answer is, just when I was starting, I made a mistake in one of the patient's chart. Thankfully, the doctor noticed it on time and prevented further complications. Since then, I have always made it a point to at least double check the data I enter and put my complete focus on the job at hand. Question number 15. What gives you the greatest pleasure in the job? Answer is, I receive the greatest pleasure when my efforts to meet the requirements of the patient are fulfilled. I like the patient under my care to stay happy, and I love it when they are able to trust me. For instance, in my last job, I had a peer rating of 95% most of the times, and that made me proud. Question number 16. What do you do to stay up to date in your field? Answer is, I regularly keep in touch with my instructors and peers from my nursing school to keep myself updated. I also am a subscriber to numerous journals and magazines. I attend many seminars in this field. In addition to these, I had enrolled in an advanced course for improvement of managerial skills. Question number 17. What would you do if you were not relieved of your shift? Answer is, I would attend to the matter at hand till the replacement arrived, and then I would talk to my supervisor to know what happened. Question number 18. How comfortable are you being part of a team? Answer, while I enjoy the independence that working alone provides me, I know the importance of being part of a team and always look forward to learn from my peers and from the new challenges arising out of the situations. Question number 19. How would your friends describe you? Answer, my friends would describe me as someone who has excellent communication skills and is very level-headed when it comes to stress situations. There was a time when a patient's blood pressure was falling. I was among the few in the room who was not nervous and was able to execute the doctor's order to the T. Everyone was impressed. Last but not the least, question number 20. What would you do if you saw another nurse administering an incorrect drug? Answer is, I would immediately protest. If the colleague owns up to his mistake, I would immediately set about administering the correct procedure, else I would run to a doctor and explain the situation. So armed as you are with these interview tips and answers, it is best to go soul searching in preparations for your interview. Not only would the effort show during the interview, but it would also make you understand yourself much better in terms of your profession. So, let's move towards the conclusion. The bottom line is this: be prepared, do your research, and understand the job you are being interviewed for and how your skills, personality, and experience match the job's requirement. Close the interview with questions, pass on your calling card if you have one, thank them for their time, and give a firm handshake before smiling and saying goodbye.